This is Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Audu. To commemorate 2021 World Patient Safety Day with the theme Safe Maternal and Newborn Care, the World Health Organization has called on all stakeholders to act now for safe and respectful childbirth. As according to the Global Health Body, 810 women die every day from preventable causes related to pregnancy and childbirth. In addition, around 6,700 newborns die every day, amounting to 47%. The University of Calabar Teaching Hospital has performed its first open-heart surgery operations with a 70% discount on the cost. The operation, according to its Chief Medical Director, Professor Ikpeme, is a partnership with the VOM Foundation from the United States of America. The CMD expressed gratitude to the federal government, among other stakeholders that contributed to the feat. The 16 states and the Federal Capital Territory reported 601 new cases of COVID-19 on Thursday, according to figures released on Friday by the Nigeria Center for Disease Control. The health agency also reported 7 COVID-19 related deaths. According to the agency, the 601 new cases were recorded from Lagos, the FCT, and 14 other states. Lagos State recorded the highest number of new infections with 173 cases, followed by Edo State with 97 and FCT 68 cases, Rivers 50, Delta 45, Kaduna 28, Ondo 28, Akwa Ibom 25, Bayelsa 16, Imo 16, Plateau 15, Anambra 12, Ekiti 11, Cross River 6, Oyo 6, Gombe 3, and Benue State 2 cases. New study reviews Ebola survivors can trigger outbreaks years after infection. Ebola survivors can relapse and trigger outbreaks at least 5 years after infection, and long-term follow-up of former patients is needed to prevent devastating flare-ups. According to new research, scientists already knew Ebola could lie dormant in survivors who test negative because the virus is in tissue rather than circulating in the blood. But analysis of an outbreak this year in Guinea, published on Wednesday in the journal Nature, found these virus reservoirs appear able to awaken and cause new infections and transmissions years on. And 1.7 million out of 1.9 million Nigerians living with HIV have been discovered by the National Agency for the Control of AIDS, NACA. This was disclosed to newsmen by the Director of Community Prevention, Care and Support Service of NACA, Alex Ogundikpe, on Wednesday in Abuja, adding that afflicted have been enrolled for treatment. And this is TOS Television Network. You're watching Health 54. Do stay tuned. Welcome back. Niger State Commissioner for Health, Dr. Muhammad Makundsidi, has disclosed that over 100 people have died from cholera outbreak in the past 2 months when the disease was noticed in the country. He said the outbreak occurred across the 25 local government areas of the state. The commissioner stated this during a training workshop organized for journalists by Pathfinder International in Minna. He said it was first rampant in 18 local government areas and later spread to all the 25 local government areas of the state. The commissioner said the open defecation and wrong waste disposal attitude of members of the communities, especially in the rural areas, have been responsible for the number of cholera deaths and infections. And also, Commissioner for Health Professor Akin Abayomi of Lagos State said Lagos State government is set to scale up interventions for endemic neglected tropical diseases, especially schistosomiasis and soil-transmitted helminths in local government and wards with prevalence of the diseases. Abayomi, who made this known on Wednesday at a data dissemination workshop on schistosomiasis implementation in Lagos, States organized by the Federal Ministry of Health in collaboration with Lagos State Ministry of Health and a non-governmental organization Mission to Save the Helpless noted that interventions aimed at the control and elimination of NTDs will be accorded the priority it deserves as part of the state government's disease surveillance control program and policies. And for the first time in more than 2 decades, a team from the KEMRI Wellcome Trust Research Program and University of Oxford have quantified the risk of children suffering severe outcomes from malaria. According to the findings, reducing malaria transmission by a quarter will have the rate of children needing emergency care for severe, life-threatening malaria. Tens of thousands of children are admitted every year to hospital with severe malaria cases. These findings can have a significant impact on many thousands of young children. The research supports current interventions policies focusing on younger children as the most effective strategy for preventing severe malaria disease. And about 3,000 health workers in France have been suspended because they have not been vaccinated against COVID-19. A new rule which came into force on Wednesday made vaccination mandatory for the country's 2.7 million health, care home and fire service staff. But French Health Minister Olivier Véran said on Thursday that most of the suspensions are only temporary. Many are now agreeing to get jabbed because they see the rule applies to all doctors, nurses, office staff and volunteers. President Emmanuel Macron first gave workers notice of the rule change on July 12, warning them that they needed to get at least 1 jab by September 15 or resign from their jobs. And just before we go, a new study published in the New England Journal of Medicine finds a single dose of typhoid conjugate vaccine licensed for children as young as 6 months to be 84% effective in protecting against typhoid in Blantyre, Malawi. These are the first efficacy results from Africa and part of a 5-year multi-country project to accelerate introduction of TCV. The findings are critical as typhoid is an increasing public health threat across sub-Saharan Africa due to the emergence and spread of multi-drug resistant strains, which are now common in Malawi. An estimated 1.2 million typhoid cases and 19,000 deaths occur each year in sub-Saharan Africa, which includes Malawi. Most of these infections occur in school-age and preschool children. That is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way again, do stay healthy. I am Rose Audu, and many thanks for watching.